Alright, here we are with an article by Kroll and team in the Journal of Cephalalgia back in 2018. Looking just at aerobic exercise for migraine and coexisting tension type headaches and neck pain. A well done RCT we have here. So they did a baseline diary for 4 weeks, and they did 3 months of exercise while doing the diary. This is the intervention group anyway. The control group just didn't do the exercise part. And then a month before the follow-up, they also did an exercise diary. And that was at 6 months from baseline, so a 3-month break of the exercise intervention. They were told that they could continue to exercise at their own preference, so no specific guidelines. Inclusion criteria was at least 2 attacks of a migraine, and a minimum of 1 day with tension type headache, and minimum 1 day with neck pain per month. And you found that out with the headache diary. Let's see, they used a number of ways to measure with outcome questionnaires. They looked at physical activity, psychological well-being, the impact, which had 79 items, so very well done there. And then they used the aspirin submaximal bicycle test. And then during the study, they basically stuck with what they were already doing. Any activity, medications they were already doing, they stuck with, they didn't increase. And so the exercise group got 1 in session with Dr. Krøll, 1 a week, and then 2 on their own. And in the session, they were very well trained with the rating of perceived exertion, so they could get up there with aerobic training and be in the right parameters, which was reasonably intense, getting up to 16 RPE. And then the primary endpoint, so what they're looking at is number of days with migraine. And then there's a lot of secondary endpoints of everything with tension type headaches, neck pain, activity, fitness level, yada yada. And then the primary endpoint, actually there's no difference between of improvement between the exercise and the control group. Even though there was a decrease in migraines for the group, that's the within group, the exercise group did decrease significantly, but it just wasn't significantly different compared to the control group. But the between group differences and within group differences were both significant for a lot of the other secondary things for migraines and tension type headaches, neck pain, activity, yada yada. And so we scroll through here, finish out the article, and the main thing is that exercise does improve health. We all know that. It does seem to improve some things with migraines, how much it is compared to controls, and there's other benefits that it does have there as well, but it was only done for 3 months, and then they measured it at the 6-month mark. And so what we don't know is if they kept doing it longer, where would we be at? And remember, this is just a single intervention that they looked at, and it's not multimodal, but it could be used as a part of a multimodal treatment.